This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Hello and welcome to HealthLink, a television program that connects home, community, and healthcare. My name is Carol Merton, and today I'm delighted to welcome Debbie Caswell as a guest to our program. Debbie is coming to talk to us about a program that she's planning on starting up here in our local area. And this is not a program that I was aware of, so I'm very keen to learn more about what she has to offer. And it's a Holding Hope group. And it's the overarching organization is Mums Stop the Harm. So Debbie, welcome to our program. Thank you for being here today.
Thank you, Carol, for having me. It's my pleasure to be here.
My pleasure too. I just want to introduce the Holding Hope support group, but then I have some questions for you and how it will be. But thank you for the information you provided to me because this was new to me. So Holding Hope support is offered by Mums Stop the Harm, a network of Canadian families impacted by substance use related harms and deaths. And it does Mums Stop the Harm, advocates to change failed drug policies and provide peer support to grieving families and those with loved ones who use or have used substances. So, oh my goodness, what a mission and mandate that is. Debbie, tell me a bit about yourself and why you're here on this program today. What can you share with us?
So I'm a registered social service worker professionally. I work at the legal clinic, but this is totally outside my job. I'm a mom of 3 beautiful daughters, and one of those daughters lives with mental health and active substance use. She's almost 23. We've been struggling with her for 7 to 8 years. Sorry if I'm emotional. And I've walked this journey a lot.
Take your time, take a breath if you need to.
I've walked this journey a lot with the support of just my family, my daughter's father and her sisters and her stepmom. And I was doing research, and a few years ago, I came across Mums Stop the Harm, and I really liked their philosophy. It was my philosophy for how I work professionally, seeing people for who they are, not for what their behaviors may predict. And then I discovered they had Holding Hope groups, which were peer support groups for families of those living with someone with substance use disorders. And I found out there was one a few years ago in the area, but for some reason it stopped. And I just felt like it is something with substance use growing in our area. I've heard some stats recently from the Youngstown Police about how many fatal overdoses they've attended in the last 3 years. And that scares me. And I just like, if I could help someone in their journey, the way from what I've learned in my journey, I would love to. I know everybody's journey is different. So my daughter's journey and my journey is going to be different than other people's.
Yeah.
And so, I mean, I'm very lucky. I know a lot of the supports that we have in the area. I'm connected to them. Like, I know about the SOS team that we have in the area. I know about what counseling services we have, but there's people out there that don't know about those services. And in my job, I do a lot of system navigation. I've been in the social services field for a number of years here in Owen Sound, and I just feel like what I have to offer might help someone else. And if I can make anybody else's journey a little bit easier, that's what I would love to do. Plus, I may learn something from my own journey that's going to make my journey easier for me. So,
first of all, thank you for your courage. The very fact that you're willing to share with us in this venue speaks so much about courage. And and you're a professional and you've raised children and you're in the system and you're identifying a need for a support group for families and those who are supporting either in different stages of addictions or substance use. So having that living experience of someone is also the personal and touches deep to home for sure and has so much significance, I think, when you're walking along with others. So you've identified you want to start a group. Now, my understanding, and I know our producer will run the information along the bottom of the screen, but the location for the groups will be confidential because of privacy. Can you tell us a little more about how the groups function and what people might expect, or if they just want to talk, who do they talk to about, gee, do I think this is for me?
So there is the email that's going to be running across the bottom of the screen. We're trying to keep the locations confidential because we want it to be more of a closed group situation. So it's not like people can't come in whenever they need to. They can, but we don't just want people coming this week and not coming next week. And in that closed group, when there's forms to be filled out, confidentiality forms to be filled out, there is more of a bond and there is more willing to share that information if you're in a group that you are with on a regular basis. So similar, I know AA has closed groups for some of their members. It's similar to that. We don't follow this 12 steps like AA or Al-Anon at all, but we'll be doing some education and things like that, talking about stigma and how we can overcome stigma towards our loved ones. And so that's why we're not sharing the location per se, but if anybody is interested, by all means, send me an email. I will get back to them. I usually try to touch base with people. I think I have 4 people right now that are interested in the group. And so I've touched base with those people, and our first meeting is going to be in April. So I know some of the people I have met with have said they've tried peer support groups before. They just haven't been their fit. I've tried peer support groups the past 2, and they haven't been a fit for me either. So
tell me what would make a good fit. How, maybe walk me through. Let's say first meeting. What would I expect if I wanted to attend as somebody who was interested? Tell me what I should expect, and how is this perhaps different from other support groups?
So in our first meeting, one of the first things we're going to do is we're going to identify the needs and the goals for the group of the people who are the core group starting out, because we all may have different needs. And we'll just kind of talk about what each of our needs are and what the goals are for the group and what people want to get out of the group. And because we're kind of building it from there up, like if people are more interested in knowing about local resources, then I know as the facilitator, I need to search out people who can come and talk about some local resources that we have. I have had somebody from the outpatient mental health. They've said they would come and talk about what they do if I wanted them to. And like, I would like to have somebody from the SOS team come, because I think that's a program that we have in our community to support those living with substance use that a lot of people don't realize they're there, or what those people on the SOS team do or can do. And so I'd like to have somebody from the SOS team come and talk to us about what their program offers those living with substance use in our community. And I mean, if it's just even maybe one of our goals will be, how do we as family members overcome stigma? How do we start that little fire that's going to maybe put people talking in first person as opposed to the addict, the junkie, that kind of thing, as opposed to somebody living with substance use, somebody who's struggling with mental health, with their mental health. So
Yeah.
that's kind of always the way it is. For
Yeah.
me personally, I see mental health and addictions just as another kind of source or form of disease. And I used to, when I was a caseworker for Ontario Works, I used to tell my clients when they'd come in and say, well, I've got some mental health issues. And I'd be like, well, you know what? You just have some chemical imbalances in your brain. Unfortunately, there's a stigma attached to those. But I have a daughter who is a diabetic. She has a chemical imbalance in her pancreas. There's really no difference. They're both diseases, and they're both diseases that we need to deal with.
Yeah. So
So
it sounds like one of the main components that you'd like to work towards is education and information. And it sounds like you're already connecting with some groups or individuals in the community that will help you. Now, again, not to disclose the location, but do you anticipate that this will always occur in a certain geographic location?
um, because I'm a new group, we can kind of figure this out. Because we are serving Gray and Bruce, we may find out that having in-person meetings might not be the best solution for us. Having the Zoom calls, or even having a hybrid meeting of having some people show up at the meeting place and having others by Zoom may work better for us.
Yeah.
Because I mean, I wanted to encompass Gray Bruce because it is an area that we do have the similar situation, but it is a huge area. So, and we all know in our winters, although this has been a good winter, but in our normal winters, traveling to a meeting might not always work out. So I'm thinking that I'm probably going to lead towards a hybrid kind of meeting where we could do it either way.
Yeah. Yeah. Just to be adaptable to the needs of people for sure.
Yes.
You
Yeah.
mentioned about stigma, and you're open about discussing about the situation that your family has. And when I say situation, helping to support someone who has substance use. But not everyone is, and that's a stigma as well, to feeling safe and comfortable to speak up. Do you think that this group will help others feel that they can speak up?
I think it will. It took me a while to be able to speak up about our situation. Um, my daughter was like the perfect child. She, like in grade 8, in grade 9, grade 10, she was on the honor roll. She was like Miss Little. She had confidence. She was a competitive gymnast. Um,
Wow.
Nobody would have ever thought that she would have ended up where she is today. And, um, but it happens to everyone. And I think just when you come forth and you tell people, hey, you know what? I have somebody living with substance use disorder.
Yeah.
It opens the door for them to say, wow, like I've lived with substance use in my past, or I have a child or a loved one dealing with substance use disorder. And people feel alone with it. And I think once people get over that stigma that it's not something to be looked down upon, people can be open, and more people will talk about it. And I think that is one of the issues in overcoming this. I mean, we all see on social media, with especially here in Owen Sound, we see like people are really negative about who's in the downtown and what they're doing and what it looks like. But they always forget that those people have always been, they're somebody's daughter, they're somebody's son, they're somebody's grandchild, aunt, uncle, brother, sister. And we need to remember that there were those before they were using substances.
Yes. Yes. It's interesting you comment on that. And what struck me, and this was just a little while ago, I was out for a walk with my dog, and I passed an elderly lady, and there was a recent death from an overdose poisoning from a toxic drug supply. Didn't know her. She stopped me to talk. And she said, and this was a grandmother about her grandchild. And I thought, this affects people through generations, and you mentioned grandparents, and she talked, and she needed to talk. And I'm thinking, it's not just the immediate family. It can be wide and spread wide and far. It could be coworkers who know that someone is struggling, to be able to share their story. So in this group, you mentioned you'd been to other peer groups. In this group, what will make it different for you? How do you envision it might be different than what you've experienced?
From what I've experienced, the peer groups that I went to always seemed like, well, this is how you have to do it, and this is the way it's going to work out for you. But that wasn't the way it was working out for me, and that wasn't working for me. And what they were suggesting wouldn't have worked with my daughter. And so with Mom Stop the Harm and the Holding Hope, we know that like I had said before, everybody's journey is different and everybody's using is different. So the way that my daughter uses my daughter's situation is not going to be the same as somebody else's. And I mean, some people may use and they hide it. Other people, you may see them using it on the Second Avenue, right?
Mm-hmm.
But it's the acceptance of everybody's individuality that's going to, I hope, be what helps our group. So, and that'll be in our first meeting. That'll be something else that we talk about is not being judgmental of anyone. We accept everybody's situation as it is, and that's just yeah.
Is there a limit to the group size? You mentioned you had a few others that are interested, which is remarkable, right? It's a good beginning.
I think we'd have to play that by ear and see. Like, I think once the group gets going, we'll know what an optimal group size would be. I mean, I don't think that we'd ever get up to 100 people. A lot of the groups, from what I understand, the Holding Hope groups are fairly small groups throughout the country. So, I mean, I have 4 people that have showed interest, but those people may come and they may decide that this isn't a group for them, and that's okay. They've tried, they've explored, and if it's not right for them, that's their decision too. And but I would like to see maybe like 10, 12 people, maybe. That's a nice size.
Yeah. So in the information that you sent me, so Holding Hope was started as a pilot project in Victoria, BC. And now it also says Mothers Stop the Harm has grown to over 2,000 members. And that, when you think about it, that's significant for sure. Now, you mentioned about local resources, but you have the ability to help people connect with other resources that are more international or national. Can you mention a little bit about Healing Hearts Canada or any of the other organizations that people might find helpful?
So I'll start at the top level. So Mom Stop the Harm is actually an advocacy group.
Okay.
And they are really looking into changing policies across the country. And so recently, a few weeks ago, on the Mom Stop the Harm Facebook page, they sent out a link that was from ONA. And ONA is wanting to petition Doug Ford to do something about the opioid crisis we have in Ontario. And
now, ONA means?
Oh, sorry, Ontario Nurses Association.
Yeah, thank you.
So, and they're a huge advocacy agency in their own, but they had put this out. So, I mean, Mom Stop the Harm put it out, and I shared it with a number of people through my social media and that, and we signed the petition, and so they're looking at how to, like, in various provinces. So each province has their own kind of board for Mom Stop the Harm. And they have group meetings where they'll talk about what advocacy is happening initiative wise. And then there's the Holding Hope groups. And then the Holding Heart groups are also peer support groups. And they are for people who have lost someone to substance use disorders.
Yeah.
So,
well, there's various supports, including not just locally, but further afield as well. Does it cost money for people to be part of this group?
it doesn't. So Moms Stop the Harm, they have social media pages. You can go on there. You can pay and become a member for Holding Hope. And I mean, I had to pay to be a member to be able to become a facilitator. So, I mean, it's minimal amount of money, like $10, I think, or something like that. Very, very little amount. But other than that, no, you don't have to. And Holding Hope is funded. They got funding from the federal government to run the program. So, but they try to run it very, so everybody who, like all the facilitators are volunteer, all the, they try to find where we hold our meetings, we try to find them in places where they're not going to charge us and things like that. So a lot of the budget is for promotional and education for the facilitator. So as a facilitator, I had a 4-hour pre-training that I did. It was watching a video talking about substance use and change and just substance use in general. And then there were 2 Zoom trainings that I had. They were, I think, 2 and 3 hours long. So I've had like 9 hours of training to do this, on top of what I already know from my working in social services.
Right, right. For those who are listening in and watching this program, is there a way the community can support the initiative, either through donation or spreading the word? What would you say to the community as they're watching this program?
Spreading the word. I mean, and joining Holding Hope and Mom Stop the Harm, and like getting on board with advocating to the government for changes that we need. Just maybe just even educating themselves on the stigma that people may not think that they have preconceived notions, but just educating themselves on what's happening out there, educating themselves on what is substance use and why is it happening and what can we do to stop it and how to help somebody who is holding hope that, their loved one is going to recover from this.
Now, from the local perspective, and you had mentioned earlier in the program about the increased use that statistic-wise of the that you've obtained. Tell me what your concerns are and what you think would make a difference to help you hold hope.
My concerns are the increasing number of deaths to overdose. And I mean, lots of times when I find out who's passed away, I know them. I've met them. I've either from my previous position or my position here. I know who they are, and it's like, oh, it's hitting close to home, and just to have the education out there. And I mean, I truly believe there's not enough treatment facilities out there that are publicly funded. I've looked into, because my daughter has talked about, I want to get sober, I want to get clean. And I'm like, okay, well, so I always like to be prepared. And I've looked into private centers and they're like really pricey. They're like $20,000 to $30,000 for a 45-day program. And, there's anybody living in low income. How do you afford that? Like, you can't afford that. And there's just not enough publicly funded space out there for people. And I think that if we had more publicly funded spaces, I know we're waiting for our lovely campus to open, and I can't wait till it opens because it is going to provide more space for that's going to be publicly funded for people fighting mental health and addictions. And it's so needed in our community. And
Yeah. And
so,
and I know you've talked about the deaths and the rise. But there are many, many times people almost die.
yeah,
And um that's a concern on the frequency. I have to be honest, when I hear the sirens go, I know where my mind goes, and I'm going, oh, I hope it's not. And I wouldn't have thought that 5 years ago. I would have thought that a heart attack or whatever. But more
yeah.
and more, my mind goes to, oh dear, I hope that's not someone who, it is experiencing toxic poisoning or overdose, for sure.
I know, and I know that controversy over safe injection sites and harm reduction. But if people really researched harm reduction and safe injection sites and safe supply, um, I mean, people are living using substances. That's a fact. So harm reduction, safe supply, safe injection sites, that just makes it safer for those people that we can still hold on to our loved ones. They're using in a safer manner. There may not be as many fatal overdoses. And I get people, I know what people say about harm reduction. I'm a total believer in harm reduction. I did see a quote the other day that was very powerful. It was, recovery does not actually mean abstinence. It means a step in the right direction. So asking someone to totally become abstinent and not use drugs may be a little overwhelming for them. But you know what? Taking that one step at a time to reducing the harm, maybe eventually they may end up being abstinent, but they're taking those steps in the right direction. And that's what really counts. And yeah, my daughter has told me that she has used Narcan a number of times on some of her friends. That scares me because I think, what happens if you're the one that needs that Narcan? And what happens if your friends aren't there for you?
Yeah, and one of the organizations that provides care and services, their goal is to keep people alive long enough until they can get into a treatment facility. And to me, that just says it all, for sure. Debbie, our program is almost over. It's been absolutely delightful speaking with you. I really encourage our viewing audience to spread the word if they know of anyone who might benefit from this program or want to learn even more about it, to definitely access the information that's being provided. Thank you for doing this, Debbie. You're offering an amazing opportunity for people for a safe place and a safe space to hold hope. So I want to thank you very much. And I hope you'll come back on the program and tell us how it's going, because that would be really, really interesting as a follow-up. So thank you, and all the best to you.
Thanks, Carol. Thanks for having me. And I'd love to come back and give an update when we get up and running.
Excellent. And thank you to our viewing audience.
Connect with us by visiting our website or email us at comments@rogerstv.com.
With Rogers TV, you can cheer on the home team from the comfort of your living room. We'll head to the rink, the field, the court, or the pitch, so you don't have to. Tune in and cheer on your local amateur athletes on Rogers TV.
Everyone wants to know about everything Blue Jays.
Blair and Barker know what's up.
Over under an 86.5 wins.
I'm going to go over.
What's the